All right, let's get right into it. We're going to tackle a topic that, gives so many people a headache: endocrine medications for the NCLEX. If you've ever found yourself drowning in endless drug lists, trying to just memorize everything, well, you're in the right place. We're about to completely change how you approach these meds, shifting you away from just memorizing facts to actually thinking like the NCLEX wants you to. And this, right here, is the very first thing you need to get into your head. The NCLEX isn't going to ask you, what's the exact dose of levothyroxine? No way. It's going to ask what you, the nurse, are going to do when your patient's dose is clearly too high. See the difference? It's all about patient safety. And this is where things get serious fast. A missed BP check, a lab value you glanced over, that's not just a little oops. With endocrine meds, that's how a small side effect can suddenly spiral into a full-blown, life-threatening emergency, like a thyroid storm or an adrenal crisis. So let's be totally clear. The NCLEX isn't here to trick you with some obscure drug formula. It's a test of your judgment. It's really just asking one simple question. When you see those danger signs flashing, can you recognize what's happening and act fast to keep your patient safe? That's the whole game. So what we're about to do is kind of pull back the curtain. We're going to give you a preview of the exact method we use at Exam Coaches to build that high-level judgment that the board is actually looking for. So, what's the big problem here? Why do these medications cause so much stress when you're studying for the boards? Let's break it down. Just look at this list. Does any of this hit a little close to home? I bet it does. It's so easy to get lost in the weeds, right? You're trying to remember, is this drug replacing a hormone or suppressing one? Or you forget that something as common as prednisone can totally wreck a patient's blood sugar. The real trip up, though, is failing to connect the dots, failing to link how the drug works to what could go wrong for the patient, like right now. And that's exactly what we're going to do. For a minute, just forget the drug names. We're going to focus on recognizing risk and choosing the safest action, because that is how you pass this exam. Okay, let's put this into action. We'll start with our first framework, all about vasopressin. Yeah, you'll see it for things like diabetes insipidus, but the secret is to just focus on its one main job. See how simple this gets when you lay it out? Vasopressin's whole purpose is water reabsorption. It tells the kidneys, hey, hold on to water. So what do you need to watch? Well, everything that tells you about fluid balance, right? Blood pressure, intake and output, how concentrated the urine is, and the emergencies, they're just the two extremes. Not enough effect, you get dehydration. Too much effect, you get water intoxication. Simple pattern. Okay, time for a little test. You walk into the room, your patient on vasopressin has a BP that's climbing and their urine output is dropping. What is the very first thing that should be going off in your head? What is this pattern telling you? So, here's how your brain should work. Step 1 is just recognition. Rising BP, falling urine output. Ding, ding, ding. The body is holding on to way too much water. That screams over-treatment. So your next move isn't just to write it down. No, you have to actively assess for the signs of water intoxication. Ask them, do you have a headache? Feeling nauseous? You're looking for those red flags. Awesome. Now let's use that same logic for our next framework, thyroid hormones. And with these, the one word you gotta remember is balance. This slide lays out the whole concept perfectly. With thyroid meds, you're only ever doing one of two things. You're either replacing what's missing, like with levothyroxine, or you're suppressing too much of it, like with propylthiouracil. And here's the key safety tip. The side effects of one drug look exactly like the disease the other drug treats. Give too much levothyroxine, your patient looks hyperthyroid. Give too much propylthiouracil, they look hypothyroid. It's a perfect seesaw. So let's try it. Your patient takes levothyroxine for low thyroid. They call you and say their heart is racing and their hands are shaking. What is your immediate priority? What do you check first? This is where that quick thinking kicks in. First, you identify what's happening. Palpitations, tremors, those are classic signs of a thyroid overdose, which looks just like hyperthyroidism. Okay, so what's the biggest danger with hyperthyroidism? The heart. So you go straight for the vital signs and you are laser focused on that heart rate and rhythm. That's the #1 safety threat, right there. Okay, now for a class of drugs that seems to have its hands in everything. Corticosteroids. Because these affect pretty much the whole body, our framework has to be really sharp. But we can still make it simple. At their core, corticosteroids manage stress and electrolytes. That tells you exactly what to monitor. Blood pressure, blood sugar, potassium, sodium, and this is a big one, signs of infection, because these drugs tank the immune system. The emergencies, once again, it's the extremes. Stop them cold turkey, you could trigger an adrenal crisis. Use them for too long at high doses, you get Cushing's syndrome. All right, another real-world scenario. Your patient's been on prednisone for a while. Now they've spiked a fever and their blood sugar is through the roof. You've got two big problems. What do you deal with first? This is where you have to use a mental safety filter. A fever in someone who is immunosuppressed is a massive, flashing red light. Infection is the most immediate threat to their life. Now, the high blood sugar is also a problem. It's a known side effect we have to manage. But your brain prioritizes infection first, because that can kill them quickly while you make a plan to deal with the sugar. And finally, let's talk about what is, without a doubt, one of the highest alert medications out there: insulin. With insulin, it's all about one thing: recognizing when glucose levels are out of balance. This is a situation you are practically guaranteed to see. Your patient who got insulin is now suddenly sweaty, dizzy, and not making any sense. This change happened fast. What is your absolute #1 do-it-right-now priority? This requires instant emergency thinking. Step 1, recognize these signs. This is textbook hypoglycemia, dangerously low blood sugar. Step 2 is pure action. You're checking their blood glucose this second, and you're already preparing to intervene, probably with the 15-15 rule. 15 grams of fast-acting carbs, then recheck in 15 minutes. It's all about speed. Okay, let's zoom out for a second and see how all these pieces fit together. This is how you build that big-picture clinical judgment the NCLEX is really after. You have to see how it's all connected. Vasopressin is handling water balance. The thyroid is running the body's metabolism. Corticosteroids are managing stress and electrolytes. Insulin is in charge of glucose. And a problem with one can absolutely cause a problem with the others. Thinking about those connections, that is NCLEX level judgment. So when you boil it all down, for every single one of these drugs, the NCLEX is only testing you on 3 core skills. Can you tell when a patient is getting unstable? Do you know what to monitor to keep them safe? And when things start to go wrong, can you pick the most important thing to do first? That's it. That's the entire test. And that's exactly what we do at Exam Coaches. We don't just hand you a phone book of drugs to memorize. We train you to spot complications before they turn into emergencies. We drill you on how to prioritize your actions when the pressure is on. We are completely focused on building your NCLEX level pharmacology judgment. And I want you to burn this into your memory. On the NCLEX, it is never about knowing the most. It's about doing the safest thing in the right order at the right time. That is how you get the highest scoring answers. Look, what you saw today was just a taste, just a little preview of how we do things. The full, detailed endocrine framework with all the specific actions and rationales you need to feel confident, it's all waiting for you right now inside the Exam Coaches platform.